The antidepressant type medicines, SSRIs, so they generally are fairly well tolerated, and we would almost always use fluoxetine first because it has the best evidence base and it has the best safety profile, in children at least. And again, we'd start off at a low dose and gradually increase. And yeah, fluoxetine tends to be pretty well tolerated. Adverse effects that are common include tummy issues, diarrhea or nausea, difficulty getting off to sleep. Sometimes you get an increase in anxiety initially, which can reduce usually over time. Again, there's a risk of mood becoming elevated. And there's a black box warning from the FDA. So there was a lot of concern around SSRIs use in adolescents 10 or 15 years ago. And when you start these medicines with young people, they're at higher risk of having more feelings of hopelessness and an increased chance of having suicidal thoughts. And so the FDA says basically you should be monitoring for that, and you need to warn people about that risk. So our monitoring of people on SSRIs is probably more stringent than it used to be back in the day, but that's definitely something to be aware of. And then sometimes the SSRIs can affect sexual drive, and that is often unwanted in teenagers and can be a big issue. And sometimes they're not keen to talk about those things, so it's good to outline that at the outset.
And is there any evidence that that can be long term, even if
It tends to be a
one-off?
dose-related thing, and some medicines are more likely to cause it than others. And sometimes you might give an adjunctive medicine which can actually improve that, but yeah, that's a bit complicated. And then the next most commonly used medicine after the ADHD medicines and the SSRIs, the fluoxetine type medicines, would be antipsychotic medicines. And there are more concerns from psychiatrists about those medicines. They have not as good a safety profile as the ADHD medicines or SSRIs. So they're reserved usually for severe difficulties, bipolar disorder, psychosis, extreme self-injury or aggression and autism, sometimes tic disorders. And they can be very sedating, and they can interfere with your thinking, cognition. Biggest concern around them is possibly that people develop a bigger appetite on them and can gain significant amounts of weight. And increasingly, we need to monitor for metabolic syndrome, where people put on a lot of weight and have abnormalities of their blood sugars and blood lipids. Their cholesterol goes up and their blood pressure goes up, and it's not a healthy place to be. So it's a constant balance, and some of them are least likely to cause those things and will often be used first. So a medicine called aripiprazole, but some people think it doesn't work quite as well. And then antipsychotics can also cause some movement disorders, which are of concern. So early on, people can get some cramping in their muscles called dystonia, which is pretty rare actually if you start at a low dose, and particularly with the newer medicines. And people can get a tremor or get quite stiff with their movements, or develop something called tardive dyskinesia, which is sort of one of the larger worries for psychiatrists, where they develop some mouth movements, usually after big doses for long periods, but some mouth movements kind of like a chewing, which is quite resistant, sometimes doesn't go away if you reduce and stop the medicine, and can be a difficult thing to manage in and of itself. So yeah, they're not necessarily benign, but antipsychotics we would usually reserve them for those more significant presentations. There is one issue with quetiapine. So quetiapine's a second generation antipsychotic, and it's very sedating at low doses, and there's increasing use of quetiapine for people with very significant sleep difficulties. And Pharmac and some other bodies have had concerns that it's been overused, and it potentially is, but it can be a very helpful medicine for those situations where sleep is not going well and you've tried everything else, particularly if there's bipolar disorder or psychosis or something like that in the background. Quetiapine can be extremely helpful.
I was going to say about whether or not the side effects reduce over time. Whether, do we take them off because of the side effects, or do we keep them on them?
Yeah,
until
no,
the side
adverse
effects
effects can improve over time, and there's a guy, Stephen Stahl, who's written a number of textbooks for psychiatrists, and in the adverse effect column it always says wait. Like, many things do improve, but equally some things don't, and some things like tics you need to respond to quite early, potentially.
Can you tell parents the list of side effects that are deal breakers and the list of
I
side
tend
effects
to let people know, which things am I most concerned about and which things am I less concerned about. And monitoring is important, and just discussion over time. But you do get kids who get referred back to service who haven't grown for 2 years, that kind of thing. And that's tricky. So things don't always improve, but frequently they do.